And first of all, in terms of the prioritisation you talked about, teachers, of course, are one of the key worker groups that we'll be looking at in the context of that prioritisation to make sure that they can get priority tests. You'll see more on that in the next day or two when the Secretary of State makes the formal announcement on it. But in terms of schools, the rules are clear. If someone has symptoms, they should go home, they should seek a test. If it's negative, they can, of course, return. If it's positive, they'll have to follow the self-isolation. But if pupils don't or others don't have symptoms, they should be in school. They shouldn't be self-isolating if they have no symptoms and if they haven't been in close contact with someone who has tested positive. And what we're doing with schools, because this is complex, is that the local public health teams are there to advise schools and do advise schools on the best response if 1 or 2 or 3 pupils in a particular year bubble or year group come down positive. They will then advise on who's been in close contact, how to manage that. So if people have not shown symptoms and have not been in close contact, they should be in school.
Mr. Keir Starmer have missed Prime Minister's questions yesterday, given that he was isolating at home with a child who had not yet had a positive test and has since had a negative test for coronavirus. So he didn't go to work. Teachers are not going to work and pupils aren't turning up to school in exactly the same circumstances. You just said they're in the wrong. So should Keir Starmer have turned up to PMQs yesterday?
No, I didn't say they were in the wrong. I said that in the case of pupils and class groups, because of how they are managed, the local public health team would advise them as to who, how many, etc., being deemed in close contact and who should self-isolate pending the results of that test or pending symptoms. In Keir's case, I don't want to talk about too much about an individual case because although Keir is leader of the opposition, he's got a family. It's a private matter for him. He hadn't had the results, I understand it, in time to come in for Prime Minister's questions. Therefore, he waited home till he got those results. He followed the guidance. As I said, I don't know the exact timeline. It'd be wrong for me to comment further on him or his
It's just, you can understand why it is pretty complicated for people trying to work out what's going on. One of the big issues lots of people have right now is the prospect, as I say, the testing capacity is not up to... look, I always say, credit where it's due. Always be honest about this. We've got the capacity up massively. It turns out it's not enough for the strategy the government is looking at. But we are looking, and you know as well as I do, that the government is having meetings talking about 10 p.m. curfews. There has been a lot of talk about the risk of a second lockdown, even though the Prime Minister said it would be disastrous. Do you think all of these measures are actually consistent sort of with the level of risk we are facing, given the very, very small number of deaths of healthy people under the age of 60? Were you aware, for instance, are you aware of the number of people who've actually died in this country since February to early September who are healthy and have no underlying issues under the age of 60? Do you know what that figure is roughly?
Yeah, the figure isn't broken down in that way.
Oh, it is? It is? It is it is absolutely under Public Health England document. Do you want me to tell you what the figure is, or do you want to make a rough guess at how many huge numbers of people have died who are otherwise healthy in this country?
Go for it, Julia. But the point I was making...
It's 307, Mr. Argar. 307 people between February and early September who did not have any underlying serious health complaints under the age of 60 died in English hospitals this year from COVID-19. And yet we are looking at massive restrictions to people's freedoms, mass chaos, massive hit to our economy, hit to children's education. Do you think that the government's response has been proportionate, and is what the government is planning or looking at now is proportionate to the actual risk to the general population from this virus?
Well, in the spirit of what you just said, and I always try to, as you say, be sort of open and honest with your listeners.
Absolutely accept that.
And they will judge it as they hear it. I do think it's been proportionate because that statistic you cited, without any serious underlying health conditions, it is more complex than that. But we also have an obligation to take this disease seriously, to seek to protect those who are vulnerable in our society. I think the latest death toll in this country is 41,684. That's every one of those deaths is a human tragedy.
It is.
And every one of those deaths is something we should seek to do everything we can to prevent more people tragically joining that
But you do know that 1,600 people on average die every single day in this country, and the vast majority of them don't die of coronavirus. What are we doing about those people?
Well, you, like me, probably have seen some of the analysis that people like Carl Hennigan have done on excess death rates and compared to 2018, 2019, and the analysis and explainers he and others have done as experts in this field of how to interpret this data. But there are still multiple approaches to interpreting this data at the moment. It's still relatively early, 6 months on. We started off with a disease we didn't know anything about. We didn't understand how it behaved, even its genome sequence. We didn't know how to treat it. We've made a lot of medical progress in the past months, and huge credit to our amazing scientific and medical teams who worked out how to treat it, how to keep people alive who would otherwise have died. But we do still have a very, very real threat posed to people in this country by what is an horrific disease, which does still kill significant numbers of people, and for which we still don't yet have a vaccine or a proven cure. There are ways we can reduce the death rate, but we don't have a proven cure. I think it is the right thing to do to protect life. Okay. But of course, going to your fundamental point, do we have to strike a balance in doing that with protecting the economic life of our country and ensuring that that can get up and running again, as we have done? Of course we do. And that's why we seek to strike that balance using local lockdowns rather than national lockdowns,